Hello, everyone. It's Friday, January 28th. Today's my wife Kathy's birthday, and we celebrated in the State of the State last night. I'll get to that in just a few minutes, but the sad part is we've lost another 69 people in the state of West Virginia. It's just tough stuff, and really, really tough on these families and all these people's loved ones. So please join me with prayers. Please absolutely don't let these people just become a number. We've lost 5,743 people. It'd be awfully easy just to chalk them up to a number, but they're not a number. There's somebody that's a mom, a dad, brother, sister, child, whatever it may be. Absolutely, please remember them. The 5,675th death is a 77-year-old male from Fayette County. The 5,676th death is a 53-year-old female from Jefferson County. The 5,677th death, a 79-year-old male from Clay County. The 5,678th death, a 61-year-old female from Mason County. The 5,679th death, an 88-year-old male from Barber County. The 5,680th death, a 65-year-old female from Wyoming County. The 5,681st death, a 64-year-old female from Raleigh County. The 5,682nd death is a 60-year-old female from Logan County. The 5,683rd death, a 36-year-old female from Raleigh County. The 5,684th death, an 85-year-old male from Marion County. The 5,685th death, an 88-year-old male from Preston County. The 5,686th death, a 71-year-old female from Berkeley County. The 5,687th death, an 88-year-old female from Ohio County. The 5,688th death, an 89-year-old male from Cabell County. The 5,689th death, a 92-year-old male from Logan County. The 5,690th death, a 58-year-old male from Braxton County. The 5,691st death, an 82-year-old male from Wood County. The 5,692nd death, an 87-year-old female from Taylor County. The 5,693rd death, an 85-year-old female from Mercer County. The 5,694th death, an 82-year-old female from Berkeley County. The 5,695th death, a 64-year-old male from Nicholas County. The 5,696th death, an 88-year-old male from Lincoln County. The 5,697th death, a 45-year-old female from Marion County. The 5,698th death, a 55-year-old female from Berkeley County. The 5,699th death, a 73-year-old male from Raleigh County. The 5,700th death in West Virginia is a 55-year-old male from Mercer County. The 5,701st death, a 67-year-old male from Taylor County. The 5,702nd death, an 83-year-old male from Hampshire County. The 5,703rd death, an 84-year-old male from Taylor County. The 5,704th death, a 66-year-old male from Berkeley County. The 5,705th death is a 66-year-old male from Ohio County. The 5,706th death, a 95-year-old male from Mercer County. The 5,707th death, a 64-year-old male from Berkeley County. The 5,708th death, a 65-year-old male from Monongahela County. The 5,709th death, an 86-year-old male from Jackson County. The 5,710th death, a 54-year-old female from Monroe County. The 5,711th death, a 56-year-old female from Cabell County. The 5,712th death, a 94-year-old female from Brooke County. The 5,713th death, a 61-year-old male from Wood County. The 5,714th death, a 97-year-old male from Berkeley County. The 5,715th death is a 59-year-old female from Jefferson County. The 5,716th death is an 82-year-old female from Lewis County. The 5,717th death is a 67-year-old male from Mercer County. The 5,718th death is a 36-year-old female from Berkeley County. The 5,719th death is a 72-year-old female from Fayette County. The 5,720th death is an 82-year-old male from Harrison County. The 5,721st death is a 65-year-old male from Barber County. The 5,722nd death is an 88-year-old male from Marion County. The 5,723rd death is a 71-year-old male from Fayette County. The 5,724th death is a 55-year-old male from Wyoming County. The 5,725th death, a 67-year-old female from Logan County. The 5,726th death, a 75-year-old male from Marion County. The 5,727th death is a 71-year-old female from Mercer County. The 5,728th death is a 51-year-old male from Kanawha County. The 5,729th death is a 90-year-old male from Wyoming County. The 5,730th death in West Virginia is a 101-year-old female from Morgan County. God bless her. The 5,731st death is a 77-year-old male from Brooke County. The 5,732nd death is a 79-year-old male from Raleigh County. The 5,733rd death is a 67-year-old male from Ohio County. The 5,734th death is an 85-year-old female from Greenbrier County. The 5,735th death is a 38-year-old male from Wayne County. The 5,736th death is a 37-year-old male from Raleigh County. The 5,737th death, another 30-year-old, a 39-year-old female from Raleigh County. The 5,738th death, 5,738th death is a 94-year-old male from Raleigh County. The 5,739th death is a 77-year-old male from Raleigh County. The 5,740th death is an 82-year-old male from McDowell County. The 5,741st death is a 81-year-old female from Putnam County. The 5,742nd death is a 78-year-old male from Marion County. And the 5,743rd death, 5,743 people have died. And this is an 87-year-old female from Logan County. Overwhelmingly, the people that we are losing, the people that we've already lost, are unvaccinated. All I ask you to do is consider and stack the deck in your favor. Absolutely, you should do that. Our active cases are 17,098. We have 4,668 new positive cases in the last 24 hours. Daily positivity rate, I can remember when it crossed 10 at 10 point something we thought was terrible. It's at 17.63. Cumulative is at 7.97. Recovered cases are 416,048. There's 1,063 people hospitalized right now in West Virginia. I think that's the highest number that we reported in this last go-round. Am I right about that, Jordan? Well, we'll find out in just a second. There's 225 people on ICU units, and I'm sorry, that there's 225 people in the ICU units, and there's 122 that are on ventilators. If you look at our map, we're still coming down a little bit on our red counties. We were, for all practical purposes, mostly all red the other day. I told you that the FDA has discontinued 2 of the types of antibodies, in regard to this this different variant, this Omicron variant that we have, and they've done that because they're absolutely positive that it will not work. And so, they are recommending these two pills to take, 2 oral pills, and 1 type of antibody. So we'll keep working that. You know, my medical team, you can hear from them on that. The home test, go to our COVID-test.gov and you can get information how you can get the 4 free home tests and the free N95 mask, you know how that's all going to come out and everything, and they're being made available at the pharmacies, and you should be able to get those this week or late this week, you know, like now or next week. We continue to thank our National Guard. I said it over and over last night. These people are true heroes beyond belief. Right now, my report says we've got 275 guardsmen or guards ladies that are working now in 34 different facilities in West Virginia, but it could very well be more than that. And our other people will report in. And it just flashed up to me that absolutely this number of hospitalized, and I want to make sure and go back to that in just one second, but hospitalized folks in West Virginia are 1,063 right now. There's 225 in the ICU units, 122 that are on ventilators, but the number hospitalized of 1,063 is the all-time record in West Virginia. Well, if it's an all-time record in West Virginia, what are we doing? We're absolutely flooding our hospitals. We're overrunning our hospitals. If we don't watch out, we're going to have real problems there. I remind you about being 65. If you have any symptoms, go get tested. I remind you, if you're 65 and above and you're going, or 50 and above, and you're going into a setting indoors with a lot of folks you don't know, really consider, if you've got any compromising issues, to wear a mask. I have told you over and over about getting your booster shot. I do not understand it. I do not understand how in the world people could not get their booster shot. But we've got a lot of folks out there that haven't gotten it, and that's a big time mistake. We continue to make little improvement, and Dr. Marsh told me a thing last night. Now, I guess there's a movie or something like that, that the tide washed in and all these starfish were on the beach. And they're drying up, and there's a little boy there. And the little boy was picking them up and throwing them back into the ocean. And someone walked up and said, son, there's no way in the world that you're going to get all those and throw them back in the ocean. You're wasting your time. There's no way that you'll be able to get all of them back in before they die. And basically replied, I know I'm not, but I'm going to get some. And that's paraphrasing what was said, but that's all I know we can do. We know we can't get all of them. There's no way. Some people just are not going to take a shot, period. Some people are going to get sick, and a bunch more people are going to die. But we can save some. Our numbers on 18 and over now have gone from 70.1 to 70.2. They just drag and drag. Last time I think we were here, we were at 70.7. Now we're at 70.8% of the people 18 and above in this state that have had at least one shot. It's getting better. It's not nearly fast enough for any of us, but it's getting better. So we'll just keep trying to save those that we can. All the information on the COVID vaccine line's up. I encourage you about taking advantage of the free testing. I always thank Fruth and Walgreens for all that they've done. We've got 156 outbreaks in our long-term care facilities, 1 outbreak in our churches. Get this number in corrections, overrun. 804 inmate cases at 27 facilities and 257 staff cases. In corrections today, we have over 1,000 people with COVID right now. These people have done phenomenal work, and they're going to work as hard as they possibly can to save every single one of these lives, because that's just how good that they really are. The flu vaccine, I remind you to take it. Absolutely, you can do that. At the same time, you're getting the COVID test. The rental program, whether you be a renter or a landlord, I ask you to please call us. Please see if you qualify. I remind you about giving blood. Last night I delivered my sixth, and it's hard to imagine, my sixth State of the State address. I appreciate the House and the Senate letting me come in and everything, as late as I did, because what happened when my regularly scheduled time, I ended up with COVID and the day before, and it just came out of nowhere, and it was pretty nasty. In fact, it was really, really nasty. But nevertheless, we gave a lot of news about a state that is really right side up. It's really become that diamond in the rough. I said last night, and I mean it, and I'll stand right behind it until I die. And that's all there is to it. I believed wholeheartedly with all in me that we needed to be that frog that was proud of our own pond. And I said last night, I am the proudest of all the frogs, the proudest of our pond. Because now there may be somebody equal to the pride that I have in West Virginia and the love that I have in West Virginia. And I can promise you, to God above, all the bad jokes and the bad comments, by the people out there in the world, whether it be Bette Midler or whomever it may be, in my world, they just don't work. And I'm going to keep standing up for West Virginia. I don't care what anybody says. That's all there is to it. Absolutely, I love our people and I love our state. And to be perfectly honest, the very people, that don't like you saying something back, they're jealous. They're jealous of how good West Virginians and West Virginians are doing, and the fact that they've always beat us down. Like, you should know your place. You're West Virginia. Well, I don't buy in that except one thing. Yeah, West Virginia should know their place, and that's to be first. That's to be absolute first, because we are the very, very best of the best. So anyway, thank y'all for, the House and the Senate for letting me deliver my State of the State. We got another storm coming. It's winter time. It's January. Our Department of Transportation's ready. They'll stay on top of it. We get snow. Just take all the proper precautions, enjoy the beautiful, beautiful, beautiful snow that we have in the state of West Virginia. So we'll stay on top of it and keep you posted. I've got an announcement here about the Huntington Fire Chief, Greg Fuller. He's getting ready to go into his second term, or second stint as our Huntington Fire Chief. He very well could start next month. He is currently the Deputy Director of the West Virginia Department of Homeland Security Emergency Management Division, and he was named this morning as the new Chief of the Huntington Fire Department by the Huntington Mayor. He's a great friend, Steve Williams, and Steve does a wonderful job, and I thank him so much for all that he's doing, and he couldn't possibly be picking a better guy than this guy. So, Greg, we congratulate you, and we'll look for you doing more and more good stuff there. The last thing I've got is a program that we announced last night with the remaining dollars that we had of CARES dollars. We had $22 million left. We're going to put it into this program where we're going to try to absolutely encourage in every way and incentivize others, other people that are still out there that haven't gone back to work. We're going to give them a $1,500 check if they can demonstrate to us that they can go get themselves a job. We've got all kinds of jobs all over the place where people are waiting on them. If they can go get them a job and they can stay in that job at least 8 weeks, which is not very long, and everywhere we'll give them that $1,500, and that'll be a nice little pop to them. Helps surely with all this inflation stuff that's going on. But more than anything, what we're trying to do is mimic Oklahoma on this. You learn from your neighbors if you'll keep your mind and eyes and ears open and everything. But absolutely, Oklahoma has this program in place, and it's done really good. And it's brought a lot of people back into the workforce for good. That's what we want. We don't want an 8-week stint. We want you to come back, get a taste and a value and the pride to be back working, because that's what West Virginians do. So we're going to try to incentivize you and try to get you across the finish line and then turn you loose and let you go. But anyway, we're going to call it our Job Jump Start program. We've got the lowest unemployment rate in the history of the state, and there's not all that many out there that that we haven't gotten back in the workforce, but there are there's still a good many that we can get there. So that's what we're going to try to do. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. And reinforcing some of the very important points that the governor has made, we know that we have now seen the highest number of West Virginians in West Virginia hospitals with COVID-19 over the past 2 days that we've seen at any other time in the pandemic. And when we look at our cases, it looks like we may be starting to plateau and maybe even start to go over the sort of the coming downside, although that may be premature, and we'll see how things unfold coming up in the next several days. But we know that there's always a delay between the cases starting to come down and the number of hospitalizations and the severity of illness, and then finally the number of deaths. So it's still really important, as the governor has said many times and said again today, that we try to protect ourselves in the most beneficial way. And by doing that, we protect each other and we protect our hospital capacity, which is really vitally important. I want to spend my time today talking about the impact of booster shots and for vaccines for people who are both have normal immune systems and who have abnormal immune systems, people that their immune systems don't work very well. And when we look around the world and look at the US, we see that 99% of the people who are dying of COVID-19 in the US and in Switzerland, as two examples, are unvaccinated. And we see that in Switzerland, the people that are fully vaccinated and boosted, if you go through age 70, there's not been anybody that's died of COVID-19. So I think it's really important for us, as we look at the benefit of full vaccination and boost, that we keep that in mind, because that is the way that each one of you, each one of us can run to the fire and pull the rope in the same direction and try to reduce this surge on our hospitals. And very simply, people who are over 12 years old, who are 5 months from their second dose of Pfizer for the 12 to 18-year-olds, or Pfizer Moderna for people over 18 years old, are eligible to get boosted. And boosting, as we've talked about, makes the biggest difference in reducing the risk of death, reducing the risk of hospitalizations, and reducing the likelihood that we're going to overwhelm our hospitals right now. And so that's true for everybody. In people that are 12 to 18 years old, boosters are available, but just in the Pfizer vaccine, over 18, Pfizer, Moderna. And a booster dose is a dose that is important after the first series of vaccines, so that you give the immune system an extra boost or an extra opportunity to become re-engaged with that critical part of the vaccine, which allows us to have the most active immunity if we get infected with COVID-19. So a boost is really, as it sounds, which is an augmentation of the immunity you got from your first 2 doses of the vaccine, so that your immune system is as active as could possibly be. So if you get infected with COVID-19, you can keep from getting sick, keep from going to the hospital, keep from dying. Now, in people's whose immune system don't work well, whether that's because they're getting chemotherapy, whether it's because they have a genetic problem, whether it's because they're taking drugs for their rheumatoid arthritis or other inflammatory illnesses, then people who are immunocompromised, it's been clearly shown that they benefit from 3 doses of vaccine, which are the third dose separated by 28 days from the first 2 doses. So if you get Pfizer or Moderna and you're immunocompromised and fit into that category, then 28 days later, you're eligible and you should get another dose of vaccine. That's not a boost, that's a third dose, because we know that whose immune systems are kind of sluggish, it takes them more stimulation to be able to mount that immune response. And just like the people who have normal immune systems, 5 months after that, then they are also eligible for a booster, which is that reactivation of the immune response. So this is really confusing, but everybody in West Virginia over 12 years old, and particularly let's deal with the 18-year-olds, everybody in West Virginia after 2 vaccines is eligible for a booster, and we know the booster makes a huge difference. Everybody who is immunocompromised, who fits under that banner, as we discussed, is eligible to get a third dose of Moderna or Pfizer if you're over 18, or Pfizer if you're over 12, that allows you, or over 5, I'm sorry, allows you to get that third dose, which is important to stimulate your immune system because it's not as active. And then 5 months after that, you are also eligible for a booster. And we know that the boosters are critically important right now. So we really call on all of our citizens to please get vaccinated if you're not, so important, but also please get boosted because we have so many people in our really highest risk age categories, over 65, over 50, who only about half of them of you have chosen to get boosted. And right now it's so important for us to protect ourselves, protect our hospital, protect our state, and this will pass, but we want it to pass with as few West Virginians suffering and dying, and as few hospitals having more and more problems taking care of the people's problems, people's illnesses that we have done, I think, relatively well during the pandemic and want to continue to do well until this is over. Thank you.
Thank you, Doctor. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Antibody deliveries were achieved this week as of today. That's 312 courses of Coronavirus that we received, and those will go quickly based on the demand for those. As the governor pointed out, significant support from the National Guard to a number of facilities actually just came from a discussion with the interagency task force folks. An update to those numbers: 39 facilities now, 4 long-term care facilities, the West Virginia Veterans Home, some of our state hospitals, to include our 2 psychiatric hospitals, are receiving support. 339 guardsmen now assigned. And Jordan, I think you may have some photos of those individuals. As the governor pointed out last night in his State of the State address, and throughout this past week, our guardsmen are providing a variety of support functions to these facilities across the state. They are happy to be supporting our frontline healthcare workers and all those on the front lines of serving West Virginians with COVID. Next, I'd like to highlight some data that reinforces comments made by the governor and Dr. Marsh. Again, if you look at today's hospital numbers, a couple of key things: 149 new admissions, in addition to the number that the governor pointed out. In addition to that, while 68% of those in the hospital are unvaccinated, when you get to
Looks like General Hoyer may be having some connection issues, so we'll move on now to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. I want to mention that we have a new tab on the dashboard this morning called Outbreaks. That tab includes information related to long-term care and to our correctional facilities. We've been posting this data regularly, but in different places on the dashboard until now. So they're now located under the same tab. The 2 data sets are different as far as collection dates. Jordan has that up for you to see. The long-term care facility information is updated weekly by the long-term care facilities, and that is updated on Friday. The correctional facility information is updated Monday through Friday daily. So we continue to try to put as much information as we can on the dashboard to keep folks informed of what's going on in the state and with this pandemic. Thank you, George.
Thank you. And General Hoyer, I believe we got you back if you want to finish up.
Yeah, so the good news is, Governor, my generator works. The power went out, my generator kicked in. So as I mentioned, 149 new admissions to the hospital as part of those numbers the governor pointed out. But the key thing that we really got to look at is 89% of the people on ventilators in our hospitals are unvaccinated. Once you get into the hospital, whether it was Delta or now Omicron, if you go to the ICU or you go on a ventilator because of pre-existing conditions, you are in serious, serious circumstances. So again, to reinforce the governor's point, Dr. Marsh's point, getting those vaccinations and getting those booster doses, if you are over age 50, our data shows that you are much more protected and much less likely to suffer significant circumstances. Another number to point out, and the unfortunate number that the governor pointed out earlier, we are showing that we are on a path to, by the middle of February, to reach 6,400 fatalities related to COVID, 100 times what we originally anticipated with the number of 64. And I just did a little bit of math earlier. Go back and take Upper Big Branch and the unfortunate circumstance of the 29 miners that we lost in that. When we hit 6,400 West Virginians lost to COVID, that is the equivalent of over 200 incidents. Go out and get vaccinated and get your booster doses. Thank you.
Thank you, sir. Dr. Inamjad is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, everyone, or good afternoon. It was a long day yesterday. I haven't had a lot of sleep, as I'm sure you guys haven't either. Governor, I do want to go back to last night because there's been some blowback today. I was listening to Hoppy Kercheval's show, and a good number of people called in or texted and were critical of the baby dog appearance last night and the Kiss My Hiney reference to Bette Midler. Talk about that and why you felt some people feel it was inappropriate and bad taste, especially since you're the chief executive of the state. But I'll let you defend what you did last night.
Well, Mark, my feelings are really simple. And, you know, when it really boils right down to it, I don't like people making bad comments about West Virginia. You know, we got two choices in that. We can either just accept them, you know, or we can reject them. You know, I think, you know, the choice of being passive and just saying, well, I'm going to just always take the high road and not say anything whatsoever, I don't think that that's what we should do. You know, we reported so much good news last night, it's off the chart. And really and truly, that good news just didn't happen by just rolling off the pickle truck. You know, you elected a governor that had a lot of experience and put that experience to work along with a lot of great people from the legislature and great people in his office and a great cabinet and everything. And lo and behold, great stuff is happening beyond belief in West Virginia. Surplus after surplus beyond belief. We've gotten through this pandemic in a lot of ways. We're building roads, tourism exploding. There's so many different things. We haven't forgotten our natural resource people, whether it be coal miners or gas workers or whatever. And there's so much good, so much good, you know, and when it really boils right down to it, you know, we have had so many people throughout all time that have stood up and done great work. And I'll promise you to God above, I am going to defend our people. Absolutely, without any question. Say what you want. but states surrounding us never thought we could compete. The Ohio's or Pennsylvania's or Maryland's, Kentucky, Virginia, whomever it may be, they never thought West Virginia was even a player on the table. And lo and behold, what did we do? We landed 3 incredible companies, just boom, boom, boom. You know, that's not counting Hyperloop and all the different things that are happening in West Virginia, is it? But really and truly, those people last night, here's what they said. Here, and call them. But the Nucors, you know, the Owens and Minor, and the Green Power people, you know what they said last night? They said just this. They said, we only came because of you being genuine. West Virginia is not the standard. West Virginia is absolutely exceptional. We came because you speak the truth. And absolutely, we're not going to go to places, if we can avoid that, where absolutely it is a political circus. Absolutely talk to them. They thought it was absolutely wonderful. They took time to take pictures with Baby Dog. Absolutely, I am going to defend and stand up and say exactly what I said last night. I want to be not only proud of our pond, I am the proudest frog of our pond. And I am not going to back up in any way. And it's a shame. It's a shame when people just dive in the ditch. They say, oh, gosh, dang, you know, I wish he hadn't done that. I wish he hadn't done this. And I just ask you to ask yourselves, if you're taking that position, what have you done? What have you done? Really, at the end of the day, it's easy for me to measure what I've done. You know, absolutely, I'm going to keep doing it because I love our people, and I am that proudest frog, and I believe in our people, and we got the very best of the best, and we're going to keep on trying to help everybody we possibly can in this state. And so I'm not backing up a bit. The Bette Midlers of the world can sit and say we're illiterate and we're backward and all these terrible things. Absolutely, they can throw rocks, but they're not going to throw rocks at my people if I can help it. Because absolutely, I'm not going to stand idly by and just say, okay, that's good enough. That's good enough. And really and truly, I thought, you know, I mean, I could have said a lot of different things about that in a lot of different ways and everything, but really, there we are celebrating the diamond that I knew we were. We are celebrating a West Virginia like nobody's business. A West Virginia that is absolutely running like crazy and has become the envy of the nation in so many different ways, and people are jealous. They want us to be back like we were. I ran for this office and put sign after sign up and said, are you tired of being 50th? Absolutely, we're not that anymore, are we? We're absolutely just flat killing it in West Virginia, and we want to just keep more and more and more goodness coming. To the Bette Midlers of the world and everything that want to cast rocks, if they cast rocks at my West Virginians, I'm going to cast rocks back, like it or not like it. That's all there is to it. I'm too proud to not defend our people.
All right, thank you, Mark. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. A couple of things. One for Governor Justice. Have you heard back from Bette Midler yet? And if so, what does she have to say? But probably a little bit more seriously to Dr. Marsh. I'm a little bit out of my element here, Dr. Marsh, so forgive me if I don't characterize this exactly properly. But Dr. Amjad asked earlier this week in a tweet that remdesivir, I think it's called, should be able to be purchased at will at any facility to fight COVID. And she was been told by HHS that only hospitals can purchase it. And she contends hospitals are maybe too overwhelmed to administer it. And so it's a red tape problem for her. But then there are people who counter that with saying that there are studies that, particularly one in the New England Journal of Medicine in 2019, it was an Ebola study. And they contend that the only reason that the medication is being used because it has a $3,000 price tag and a 20% bonus paid to Medicare, and actually it's killing people. So can you talk about the efficiency of this medication, about the red tape that you need to cut through to get it, And how do you answer people who cite a 3-year-old study in the New England Journal of Medicine and make those types of claims about it? Thank you.
Well, Kenny, before I defer to Clay, let me just say this. I haven't heard from Bette yet and everything, and I'd welcome her call at any point in time and welcome her to come to West Virginia and see just how great this beautiful state really is and how good the people really are. The other thing I'd say this, and really for those that look like they're having a bowel movement or something and can't understand what's going on, I'd say this: in life, smile a little bit, have a little bit of fun. I mean, for crying out loud, Baby Dog and what we're doing there is just a little bit of fun and everything. And we didn't like what was going on with Bette Midler, and we didn't like what's going on with a lot of people with these bad jokes and everything, and I don't like that. That's for dadgum sure, but still we want to be respectful of all and have a little fun. For crying out loud, this stuff is tough enough. We absolutely have success beyond absolute belief in West Virginia going on right now. And if we can't enjoy that a little bit, and we can't enjoy seeing a little Baby Dog and laugh a little bit, we're not much. And and now I'll defer to Dr. Marsh. If Dr. Marsh, you could answer, please.
Thank you, Governor, and thank you, Kenny. So Kenny, there was a recent study that was published, and I believe it was in the New England Journal, although maybe it have been in another very highly ranked medical journal, that demonstrated that remdesivir, when given over 3 days as an infusion, 200 milligrams day 1, then 100 milligrams on day 2 and day 3, in people who had COVID positivity and had high risk for hospitalization, that remdesivir reduced hospitalization by about 90%, which is the same benefit that the monoclonal antibody sotrovimab gives people who are in that same situation, which is the same benefit that the Paxlovid, the Pfizer pill, if taken within the first 5 days of symptoms, gives people as well. So remdesivir has been repositioned not only as a drug that may have some benefit in people with COVID who get sick enough to be hospitalized, but really its great benefit appears to be preventing people who are at higher risk of hospitalization who test positive from going to the hospital. And we just had a call this morning with the West Virginia Hospital Association and all of the large hospital systems in West Virginia, and they are ordering remdesivir and they are administering remdesivir. The challenge, again, is in the amount of resources that is needed to administer 3 different days worth of infusion, and the fact that hospitals are already overloaded. And we as a leadership team are certainly working with them, working with our community health centers and fairly qualified health centers to also look at other opportunities to infuse this. But we want to make sure that we have a full supply of all of the tools in our belt right now to try to help reduce the number of people at high risk for going into the hospital who test positive for COVID-19, so that we continue to try to reduce that surge on hospital capacity, which, as we talked about earlier, is a significant concern for us. Thank you.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to ask General Hoyer about our National Guard support. I know the other day you said our tabletop exercise estimated that we'd need about 350 guardsmen. Given that we're now within 10 of that number, are we going to reassess what we think we'll need? And then I also wanted to ask if there's been any consideration of assigning National Guard members to respond to what's going on in corrections right now. Thank you.
General, please, sir.
Yes, sir, Governor. So, Charles, yes, we have been looking at that consistently to see what additional manpower might be available. There's also been discussions with corrections. I hope folks understand that 85% of our members of the National Guard have other civilian jobs, and we have challenges bringing additional personnel on duty. So all that's being looked at and will continue to be managed across the system going forward.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. This also falls in the correctional facilities line. Our newsroom has been contacted by some who want the federal prisoners given more leeway in getting out early because of the threat of COVID. I want to get into some of the numbers at corrections. Is there a percentage of those being held that have refused the vaccine? Did they have the opportunity to refuse the vaccine? And if they did or did not, there's still an outbreak there. Governor, have you given any consideration to early release for some maybe nonviolent older offenders that would be more at risk for COVID than the younger ones? Thank you.
Paul, from my standpoint, I never try to dodge anything, that and everything, and I'm not doing that now. But we would surely, I guess you never say never, but I've got to have a lot more information on that, and I think maybe General Hoyer, you can answer some of this, but I think really and truly what you're asking is very good questions and everything. We probably need to do a whole lot more, research and look a lot deeper and everything and get back to you. But General, please.
Yeah, Paul, as Governor pointed out, every day Secretary Sandy, Commissioner Jivenin are looking at all the different options to address the challenges of outbreaks within facilities, and I'm confident that they're working on a variety of recommendations for addressing that to the governor.
All right, thanks, Paul. Next to Jocelyn King with Ogden Newspapers.
Yes, I was just wondering, as a number of us are here, the antibodies that are being, the antibody treatments that are being distributed now, are they as effective against other types of the COVID virus as they are on the Omicron strain?
Dr. Morris, this is you, sir.
Thank you, Governor, and thank you, Jocelyn. So research was done to look at the ability of these different monoclonal antibodies to bind to and neutralize the ability of different forms of COVID-19 from being able to infect us. And as was previously pointed out, that the Regeneron antibody and the Lilly antibody cocktail of monoclonal antibodies worked very well against the Delta variant and were used very widely to treat people with the Delta variant. When we got to the Omicron variant, because of the very high number of mutations, particularly in the spike proteins, which, remember, the spike proteins are like the arms of the virus that bind to places, cells in our body, and that's how the virus gains entry to our body, how it infects us. And the Regeneron and the Lilly antibodies did not bind well to Omicron. And as Omicron became the dominant form of COVID-19 in the United States, 100% now of new cases virtually in the US, and now in West Virginia, 94% in our last sequencing run of the new cases of COVID-19 that we were able to sequence, then the only antibody currently that's approved for the Omicron variant is the sotrovimab, which is another antibody that doesn't bind to those same areas that the two antibodies that don't work very well against the Omicron variant binds to another area. And it's the best antibody we have to neutralize the Omicron variant. And it translates to having a protection, just like we talked about with remdesivir, of about 90% for people being hospitalized who are at risk for hospitalization who test positive with COVID-19. So the antibodies that work better against Delta don't work against Omicron. And this antibody is the one that it really works against Omicron. And now virtually all of our cases in the US and in West Virginia are Omicron. So that's a reason why the federal government said there's no reason to use the two antibodies that don't work against Omicron, and instead suggested that everybody use the sotrovimab. I hope that makes sense.
All right, thanks, Jocelyn. Next to Marley Pinchok with WSAZ.
Good morning, Governor. So this week, as you mentioned, West Virginia has reached its all-time high when it comes to hospitalizations. Do you have any plans in the works to combat this increase? I know the National Guard has been helping out, but anything, concrete at this time?
Well, let me answer this. Guys, I could defer, to the general or two doctors, but again, let's be really, really fair. Who's got the playbook? There is no playbook. We're 2 years into this. We've had to pivot and go a lot of different directions all along. We come before you over and over and over. The plan would absolutely be so simple. If we had more and more folks vaccinated, we'd have less issues. We know that. We know that the more we'd have vaccinated, the less people would die. But people absolutely have their freedoms, and that has founded this very country. And we need to respect and absolutely stay right on top of that and honor their beliefs and wishes just as much as we expect them to honor ours. So we fight a problem, don't we? We fight a real problem that we have. And absolutely, without any question, we have told people over and over that if we don't watch out, our hospitals are going to get overrun. We haven't, just cried wolf. We've told them the truth. Over and over and over, we've told them the truth. Today, our hospitals are absolutely almost peaked out, but they're almost peaked out by a lot of different reasons. The biggest reason is staffing. Now, with that, we stepped up and we said, we're going to absolutely backfill those issues with our National Guard. Again, we had to pivot, didn't we? Just like the general just said a minute ago, 85% of these people have other jobs. But if we've got to call them back in order for absolutely to save and keep our hospitals functional, we'll do just that. At the end of the day, we continue to watch and manage these numbers every single minute. Absolutely, we have got to know that this thing could still get really bad, really, really bad. I tried to tell you the other day, after I talked, on the briefing the other day, Dr. Marsh called me on the phone and said, I'm really worried. Now, I'm really, really worried because this thing could snap really bad. This Omicron virus is so infectious that just almost any and everyone are going to get infected if you're unvaccinated. We are absolutely worried about that beyond belief. One of the lead officials in the Trump administration here months and months ago predicted exactly that. Exactly what I just said, that maybe, just maybe, the overwhelming majority of those that are unvaccinated are going to get this in one form or another. We'll end up with a run even bigger on the hospitals. And we'll have to pivot and we'll have to handle it. It won't be easy, but we'll handle it some way, somehow. And we'll get through this some way, somehow. To absolutely sit here and tell you, we got a plan for rock solid certain it's going to work no matter what, anybody that would tell you that would not be telling you the truth. You've seen so many different gyrations that have come out of Washington. They've told you everything in the world, but we haven't done that. We've told you the truth. We have absolutely told you the truth, and absolutely by the blessings, and I mean this, by the blessings of God above, we've hit the right buttons at the right time. There's no guarantee. There's no guarantee. But we're going to keep at it. We're going to keep watching these numbers, and we're going to manage this thing. We're going to get through this.
All right, thank you, Marley. Governor, I'll turn it back to you.
Well, I always make my notes, don't I? And I started off with Dr. Marsh talking about getting the booster shots. And Dr. Marsh, I hope you're still on, and I hope you'll jump in and if I misquote this. But I think Dr. Marsh said in the country of Switzerland today that for the most part, everyone is vaccinated and everyone is boosted. And I think that he said in the last recent times, there has been zero deaths from at a younger age all the way up to age 70 in the country of Switzerland. Is that correct, Dr. Marsh?
It is, Governor, for people that are fully vaccinated and boosted. And that comes from Eric Topol, who's an expert in this and he's very good with data. So that's right.
And just think about that. Let's just stay with that just 1 second. Here we've got our coronavirus czar. We've got the most educated doctor, professional on the planet. A superstar beyond belief, and God knows blessed are we to have that man. And he's telling us that in his research and everything, a country, Switzerland, has everybody vaccinated and everybody boosted, and zero deaths of people up to the age of 70 years old for a significant period of time. We know what the answers are. And absolutely, we better be listening to that man and all of our experts, and hopefully me too. General Hoyer tells us that now we have 39 facilities and 339 guard members that are working, in all these different facilities. He also tells us of a number of 149 new admissions that just happened. Do you remember what the ideal admission total that we didn't want to go past was? Do you remember that number of admissions was 60? And when we go above 60, we got a problem. 149. 149. That's not any good. The other thing is just this, and I'll end by just saying this. My methodology, my DNA has always been the same. I probably do a few things that are a little out there, and I probably make you smile and make you laugh some. And some people that are just too much a prune, they just can't get through life and have any moment of joy in any way. They pick at it and all that, and I could care less. But the one thing I absolutely do is I always tell you the truth. Whether it's a country talk or a straight talk, that's all I know to do. That's all I know to do. I have said it so many times. If the art of the deal is so easy, if you'll just think about it. I have made deal after deal after deal after deal. Just made a bunch with gigantic companies that came here. And in those deals, if you'll just step back and think, here's the way to do it, ask who you're in the deal with. What would be utopia? What would be the best for you? Tell me. And then I'll tell you the best for me. And then let's two of us work together to get as close to that as we can. You don't need to try to one-up somebody. You don't need to try to be the winner and then be the loser. In a deal like that, it never works. It never, ever works. Most of the time, it doesn't ever get done. But then, if it is done and somebody's a loser and somebody's a big winner, it's not good and it won't work. So I do this. I tell you the truth. I give you absolute straight talk, and I'll defend you to my grave. That's what I do. And then I say to you, let's evaluate if it's working. Let's just evaluate if it's working. You know, my dad always said, don't confuse effort with accomplishment, son. You've got to achieve. Last night, if you listened to the State of the State, you saw achievement beyond belief. You saw a state that really and truly, when we walked in the doors, the state was bankrupt. And you see a state now that is doing so good, it is off the chart how good it's doing. And I don't need all that credit in any way. I am telling you, there's so many good people. There's great, our House, our Senate, absolutely, there's so many good people along the way that work in my cabinet and right in my office that have done so much goodness, it is unflat believable. They needed a coach, and I've been the coach. And at the end of the day, if you look at it and say, don't confuse effort with accomplishment, I say to you all day long, let's just step back and evaluate, is it working? Is it working? And for God's sakes of living, I don't see how on the planet you can look at surplus after surplus and road after road and tourism after tourism and absolute goodness in taking care of our hungry and on and on and on, and not say it's working, because it is working and it's only going to get better, West Virginia. And that's exactly where I stand. I love you with all my soul, and I'm going to go to my grave with that. Thank you so much.